Hi, everyone. TJ Alls of I-45 Now in Galveston Now. Welcome to the May edition of Healthcare Unmasked, where today we're going to be talking with this great panel you see on the screen right now about the new UTMB School of Public and Population Health. What had been a department before is now a full-fledged school at UTMB Health, and we have a lot of exciting things to talk about with that today and what public health means for general healthcare, plus the training and the workforce opportunities that exist there today. And we're going to be joined, by the way, for the first time ever in our show, by two students of one of the schools at UTMB Health. So that's going to be one of the more interesting facts. You can hear firsthand about career opportunities, but also, too, what it's like from a student perspective. So we'll be having them joining us here in a little while. But first up, let's talk to Dr. Kristen Peake. She is the dean of the new UTMB School of Public and Population Health. And Kristen, just talk first about how this came about and why it was important. What had been pretty much a department with the UTMB Health before, now being a full-fledged school within the UTMB health education system.
Sure. Well, thank you so much for having us here today. This is just a great opportunity to talk about the school. Well, we started actually over 20 years ago as a nationally accredited program. Our accrediting body is Council on Education for Public Health, CEPH. And we started specifically for our residency program. So at that point in time, we had general preventive medicine, occupational medicine, and aerospace medicine, which is a very interesting program. A few years later, so this is back in like 2000, a few years later, we were approved to offer the MPH to all of our School of Medicine students and residents. And then later on, we were allowed to offer to the PhD students as well. Finally, in 2017, we were approved to be a standalone program. So anybody coming out with an undergraduate degree could apply for the MPH program and we could admit them. So we had actually been discussing with our president and provost here at UTMB the possibility of becoming a school. A few years ago, we're a growing program. We have a lot of faculty, a lot of vibrant research. And then, things are sort of moving along, and then the pandemic hit. So after the pandemic, with the increased awareness of the importance of public health, the UT system regents, actually, we found that they supported a school of public health. And so we very quickly, about a year ago, put together a proposal, and the UT system regents approved that. And then last August, our CEPH, our accrediting body, approved our transition to a school. So we became officially recognized as a school on September 1st. And so we've just been transitioning all year. Now, that's really important for public health. It's really important to have another school of public health in the state of Texas. As the current pandemic and many previous health challenges before have shown, the state of Texas, along with many other states, has a shortage of public health professionals. Now, the magnitude of this shortage has been increasing even before COVID-19. We were looking at numbers yesterday. 22% of public health agency employees surveyed were planning to retire in the next 5 years. Now, the Texas population is about to hit 30 million, and we have a lot of public health issues in our state, including a dramatic increase in accidental drug overdose deaths, increasing deaths related to diabetes, and the rise of many chronic conditions. So with the increasing population and public health crises, Texas can use a larger, well-trained public health workforce. So those are some of the reasons why it's very important to have another school of public and population health in the state of Texas.
And in fact, when you talk about that, this would make the fifth in the state of Texas. The UT system now, the medical center, obviously has the largest in the state. I mean, it's pretty big. I mean, it's all over. But talk about, and joining us now, by the way, is Dr. Cara Pennel. She is the Associate Dean for Academic Affairs, and also Don John, I knew I would do this to you when I gave it on. Prochaska. You would think with all the good Czech names I've known throughout life, the Associate Dean for Student Affairs there as well at UTMB Health School of Public and Population Health. But there are, and I'm glad you brought this up, Kristen, because when we talk about public health, there's been more interest drawn to that. Obviously, folks got more involved in paying attention to public health issues in many ways, COVID coming in there. But as you said early on, the demand in this area was already coming long before COVID when we talk about things and how that stretches through. So when you found that the Board of Regents were interested in that and said, yes, we need to have another school, why is the school itself important for the overall public health of the communities that that UTMB Health will serve, both the student population and out in the public itself?
Sure. So in terms of, again, our Texas population is growing, and also the aging population is growing. So with that rise of many chronic conditions, and public health research and practice promotes both disease and injury prevention, healthy lifestyles, living conditions, and healthy environments. We also respond to outbreaks. So having a school of public health, or another school of public health, will provide the structure to continue our focus on health and health-related conditions that plague our population, including many chronic conditions impacting our population in Texas. And also, as we mentioned before, training that public health workforce is critical to meet the needs of these 30 million people.
And one of the things for folks to understand about public health, when we talk about that, yes, there is the healthcare provision of that. But really, when you talk about public health, particularly, that's why it's important to have the title public and population health is that you're looking at a whole more than it is just, hey, this is how you treat this ailment, correct? I mean, as we see in this graphic here, there's a whole lot more of context that needs to go in when you're talking about public health.
Yes. And one of the things we talk about public health is what we do as a society to assure the conditions in which people can be healthy, but also with population health is an opportunity for healthcare systems, agencies, and organizations to work together to improve the health outcomes of the communities they serve. So you think of public health as more about what we're doing as a society, and population health is more about what a system is doing for their community. So both are important.
So in talking on that topic, because obviously if you have the idea is to get more folks into the workforce, and now Cara, we'll bring in, because that's what you really focus a lot on in there, because as we see what I would call the diversification of the healthcare workforce in many ways here, one of the things the pandemic also showed is how many areas of what I would call support for the medical side was just found to be wanting across the nation here. Can you talk about what opportunities are going to be available for people when they go to this school and then come out and then go into the workforce?
Absolutely. And we have a pretty diverse student population. We have medical residents, we have medical students, PhD students, traditional MPH, which is a Master of Public Health students. And so some of the opportunities that are available are in governmental public health. So when I started in public health 20 years ago, that was kind of what we were trained for, is we were trained to go into a local or state health department. That has expanded. And now we have more graduates of public health that are going into health systems and hospitals than any other field. And part of that too is training healthcare workers in public health. So we're all much more familiar with epidemiology now with COVID. And so that is a big area where we need to hire more epidemiologists. There are also opportunities in environmental health, occupational health, to do advocacy work to improve public and population health policy. And as I mentioned on the healthcare side, we have physicians and nurses who are interested in getting public health training so that they can do their jobs, but looking at it from a public health lens, which we think is really important too, to have more people in the healthcare industry that are seeing things from that public health lens.
And when we say seeing it from the public health lens, it is about seeing the whole patient, not just the time they're in the office visiting with a doctor or a nurse, or when they're in the hospital, or at a clinic anywhere, but it's about what's happening outside those doors, is it not?
Absolutely. Yes. So in public health, we look at individuals, but we also look at the environments they live in. So what is their housing situation? In terms of affordability and quality of housing, is transportation an issue? Things like economic opportunities. So all of those things influence health outcomes. And so that's what we really focus on in public health. And there's a new framework that has come out recently that puts equity at the center of public health. And that's something that we can really get behind.
Yeah, and when you talk about equity in healthcare, a lot of times we see that argued in a political spectrum. But what's really happened is I would take it then what we see with public health, when that's addressed as a whole, it actually helps bring down costs in the healthcare system when you're delivering healthcare directly, correct? Does it not?
That is exactly right. And, as we know, the United States spends a lot of money on healthcare. But in terms of all of those expenditures, public health only gets about 2 to 3% of that. So, we see a lot going to address uh, people's needs once they get sick, once they get to the hospital. But if we put more of those resources up front, we could hopefully prevent some of those issues from occurring in the first place.
Yeah, you bring up an interesting point there, because 20% now, based on the latest survey, it's 2020, the highest increase ever in the America's GDP. 20% goes into healthcare, and we should point out, of that, then only 2% goes into the public health side of things. And if there was more of that increase in the public health, there's actually quantitative data that shows you can bring down the cost of actually direct healthcare along the way.
Yeah,
So it's some
absolutely.
interesting thing. Obviously, too, with those opportunities comes in, okay, you got student recruitment. And John comes in now to start chatting with us on that, because you want to get, you got to get butts in the seats, John. That's a challenge for you in some ways. Or is it? I mean, how much is the demand for this as the studies for either the master's or in the doctorate sides of things right now?
It's a great time for public health in terms of recruitment. So not only has COVID shed a light on the role of public health in protecting society and in the need for quality public health, but there's also, as Kristen was saying earlier, this dramatic increase in openings in job positions coming down the pipeline over the next 5 years. So it's going to be really critical for us to train as many high quality graduates as we can. And the demand is out there. This year alone, our applications coming in, I'm looking at the numbers on my board here, were nearly double what they were last year. We think a lot of that is enthusiasm for the new school, but also it's partly because of the enthusiasm of the field.
And then, you talk about that enthusiasm in the field. I think too, we're seeing a change in folks that want to be a part of the public health workforce too. We're seeing that where folks realize communities were losing in a lot of areas. And sometimes I bring this up in a lot of contexts, even in the education side of things, that when folks saw that COVID hit, so much in our lives changed. Not just were we dealing with the health side of things. Yes, you got to get treatments. You got to get, therapies are out there, and but so much in our life changed overall. How to be safe at work, how to be safe when you're out in public, those type of things. So we saw this kind of emergence there where we took this pause and realized, wait, this is a bigger problem overall, not just at a pandemic time, but we also recognize maybe as a society how much of a problem is on our daily lives too, is it not?
Yeah, agreed. One of the things we often teach our students and other audiences is, your genetic code's important, but your zip code is actually more predictive of your health. So that requires a whole new skill set and a more diverse skill set. So our students are coming in with interest, as mentioned earlier, in environmental health, in clinical practice healthcare administration, but also nonprofit agencies that provide social services need staffing and competent employees trained in the topics that we cover in public health. So there's just a wide range of opportunity.
Yeah, and as we talk about this opportunity, so Kristen, let me ask along the lines here of, what do you hope to see that this program fills as far as any voids, gaps, or in expansion of healthcare overall?
Well, our School of Public and Population Health here, we really hope it's going to more strongly integrate some of the research and education strengths we have here. So you talk about gaps, but there are also some areas that we can really expand on. So, public and population health, as we talked about, but emerging diseases and global health from a public health perspective, it's a really important area to expand at UTMB. We already focus on, a lot of our faculty focus on health disparities research, health inequities, but we have a very strong national presence in research on emerging and infectious diseases with our Galveston National Lab. And it's a natural next step to expand that into the public health realm. I think that's one niche we can really fill in the state.
Yeah, I was just about to bring that up, because when you have the national lab sitting right there, this really came up in many conversations during the Ebola outbreaks that we saw some years ago, and that where UTMB Health, the national lab, on the forefront of really treating that and make sure, particularly on the U.S. side of things, as we saw cases come back to the U.S. But at the same time, the public health side of that was emerging, and folks were realizing then that was kind of maybe a precursor in many ways of how those two actually mattered: public health and finding something for those infectious diseases. And I was just about to ask how important it was to have this school, which I'm not sure if any of the others have this ability, where you have a national lab for infectious diseases sitting right basically across campus from you.
We're it.
Yeah,
So
that's
I
it.
mean, in the state of Texas, we are it. And one of our, our department broke, and as we transitioned into the school, broke into 5 different departments. Now, 4 of those departments: biostatistics, epidemiology, population health, health disparities, and bioethics and health humanities, we already had focus on in terms of research and faculty expertise. But we created a brand new area, which is the Department of Global Health and Emerging Diseases. And that new department has a brand new interim chair, and he is working on a task force with people in the Galveston National Lab and microbiology and immunology, and with clinicians, infectious disease clinicians, working with everybody so we can create, a truly translational department. And that's going to be, I think, a really important niche, again, that we fill in the state at UTMB.
We should point out, and you mentioned this at the start here, Kristen, but one of the things is that while this is a new school, none of this is really that new to all of you who are involved at UTMB Health in here, because it has been around for a good while as far as the department side of things. The new part is now we've got a broader base of our educational support, correct?
Right. We have been around. Our department is 110 years old on September 1st. So we have been around a very, very long time. And of course, UTMB has had a focus on emerging diseases and building that for a long time. We're all health inequities researchers. And 2 really cool aspects of the department that's now transitioning to the school that most schools of public health don't have. One is bioethics and health humanities. So we had an institute we have an institute for bioethics and health humanities, and now they are a department with a growing program, a growing PhD program, master's program, and we have a brand new MPH in bioethics. So that's a really cool part of our program. And another one, kind of at the other, I don't know if you want to say the other end of the spectrum, but we have Aerospace Medicine. So we are one of only 2 civilian aerospace medicine residencies. The aerospace medicine residents come in and they get their MPH. So we're the only accredited MPH track in aerospace medicine in the country. And that's a very interesting program. And we train astronauts. I mean, 2 of our students, 2 of our alum are astronauts. Serena Anon Chancellor is on our faculty. She's about to be the program director for Aerospace Medicine residency. We have Chell Lindgren, who is right now, I believe, on the ISS, so the International Space Station. So we have this really interesting program. Now, the other graduates that come out of the Aerospace Medicine residency program tend to go on and become flight surgeons at NASA. So then they continue on with their training and actually go, take care of astronauts. So it's a really, really cool program.
Well, we should point out is that, the thought of before of a flight surgeon was, okay, I think most people, the only connections they have to flight surgeons was like watching Apollo 13 and the flight surgeon saying, let's watch the monitor. But now it's commercial flight. Is becoming more and more. We're going to see more folks, not through the NASA system so much, go to space, but also through the private sector as well. So having that medical background, and I geek out anytime, the fact that you have a student right now on the International Space Station, have a member of your faculty who's to space. I mean, it's just, think about that. I mean, it is quite interesting on that one end. But another one, Karen, I know this is something that's dear to you, as many as you say, 20 years in public health, and you can see some symbolism of this behind you, is about dealing with homelessness and the public health there. that is an area that, particularly if just for the local standpoint, folks in Galveston probably are familiar with the count we do every year on the homeless populations there. But that's really also, and I hate to say it's an emerging concentration, but we're finally starting to see some turn on which of healthcare of that homeless. Or we should point out, homelessness is not just someone on the street. It could be bouncing from couch to couch and the like. But can you talk about how that is starting to change now, and particularly in attitudes where this school can help out with that?
Yeah, absolutely. And it's funny you mentioned the count, the annual count, the point in time count. We have had students involved in that for the past several years, and working on teams to go out and be able to enumerate the population that's experiencing homelessness. And like you said, that's not just people who are, under the bridge under I-45. It's also people who are couch surfing or people who are living out of their cars. And again, we really see homelessness and housing and things like that as part of the broader public health umbrella. Because along with that, I mean, people experiencing homelessness are at greater risk for injury and illness while they're living in these unsecure places. But also, yeah, there's a lot more integration of those types of issues into public health. Mental health, substance use disorder are all areas that are fit under that public health umbrella.
And so to address those, and you just point out some of those classifications, but again, it goes into that looking at the whole of the patient and the like. And one of the things is, as the school comes online, and we've talked about COVID and a pandemic, which we've been dealing with, every data we're looking at right now is we are maybe seeing more of that housing insecurity get worse now in the next couple of years as some of these programs have rolled off out there. So talk about just that from your personal perspective of where this school will be able to address that, of getting the forces needed out there to address that need on the ground, boots on the ground type of approach.
Absolutely. Yeah. One of the things that we really try to do as a School of Public Health is to engage in the community and to engage in community-based programming, to train our students to do that. So our graduates are then able to go out into the community to improve the health of the broader community. So you mentioned, housing security, also food insecurity is something that we really saw grow during the COVID pandemic. I know some of the Galveston County Food Bank and St. Vincent's and some of our other community partners really inundated with requests and needs around that time. And those continue because there is no post-COVID, I think, and there are things that are going to continue over time, issues that we're going to continue to see. But again, as you mentioned, we're training students who will go out into the field and look at the whole. So looking at housing, looking at food insecurity, looking at other issues or needs and supports and resources that communities might need.
And again, it goes into, Kristen, of talking about the difference of what we think of with a medical school is that it's just the doctors or the nurses learning about procedures, how to put a needle in or how to take your blood pressure or, how to read a scan. This is really way more of actually, I call it old fashioned medicine, where the old country doctor would deal with the patient centric, I guess would be the term I'd use for that.
Yeah, I mean, what is it? Prevention is worth a pound of cure. An ounce of prevention is worth a pound of cure. Yeah, I mean, our job is to keep people out of the hospital, out of clinics. I mean, of course, preventive care, primary care is critical. And we actually have teamed up in the past with Family Medicine, with our primary care for a particular grant where we're doing public health training for the primary care workforce. That is critical. Yes, we're all about prevention.
Yeah, but you can't get that done until you actually have folks who have had this public health education out on the road. And we are excited. First for this show is we now have 2 of the students who are joining us now, who are in this program at UTMB School of Public and Population Health. First up is Dr. Martina Michael, who's a master's in public health studies, and then Robert Rodriguez, who is a PhD student in the program and already worked on the administrative side of things at Shriners Children's. So Robert and Martina, thanks for joining us here today to talk about this. And let me start with you, Martina, is that, you were sharing with us before in our pre-interview, which we always do for these, is that you already are a physician. You were from India, and then you came here to study this. But tell us about what drew you to this program and why public health versus just going into studies of primary care here in the U.S.
First off, thank you for this opportunity. I really, really appreciate it. It's very nice that students can talk about our perspective. And to your question, so usually primary care is a gatekeeping sort of aspect to healthcare. We usually work as gatekeepers to the different aspects of the healthcare system. But when we do that, we can either give patients their prescription and their pills for their conditions that are acute or chronic, or we can advise them to go see a specialist. We don't really connect them, or we don't really know of what are the different social, environmental, and community determinants of health that the patient faces once they leave the hospital or the clinic. So this was one of the reasons that I, as a primary care physician back in India, wanted to know about the different aspects of public health that affect a patient and the consequences that they have to face. And it's not really a direct flow of events. Like, there are different factors that come into play, and we usually don't know these things. And in medical school, we learn medicine. But in public health, we're able to integrate and have a more personal and individualistic approach. We learn about communities, but we also know what affects one individual at a time.
I to put it up in a short, would it say it just makes you a better doctor?
Yes, it makes me a better primary care physician for sure.
Yeah, because you're understanding that patient from a whole, and you're taught from the start to look for things. Now, Robert, you're studying for your PhD in the program here. You're already working in the medical field as well, but from a different side, not from the medical side, but more the administrative side. Talk about what your experience has been and why you were drawn to this program.
Absolutely. And thank you very much for having us here with you this morning. I think my journey began to the field of public health when I started my career at Shriners Children's, Texas, as a clinical research coordinator. And being immersed into that world as a 23-year-old, it was such an amazing experience to see and to be in an environment that was very interprofessional based, and there was such a multidisciplinary approach to the patient healthcare and healthcare experience. And as I continued maturing and evolving in that field, I was trying to understand, where can I become a more proficient individual in the healthcare setting? How can I better serve not just the patient, but even my faculty? And so I explored the field of public health in the year 2017. And to my surprise, never really knowing much about public health, it was very much the same setting that I found in the healthcare industry: interprofessional, multidisciplinary. And that just really empowered me to want to pursue a higher education in public health and to explore what other avenues in this new field I can grow in as an individual.
One of the things I think we can talk more about on this now is, and Martina, you shared this with us in our pre-interview, was you and appreciate that diversity. That was a big draw for you to come specifically to this program at UTMB Health, did it not?
Yes, of course. The diverse environment in UTMB is pretty unique to compare to different schools in Texas. When I was applying to the Master's in Public Health program, I was looking at the diversity. UT Houston has that diversity, but UTMB also has it in a different aspect that's unique, that we have a diverse student community as well, where it's not just that they come from different backgrounds, but they also have different experiences. And we have different students who are doing the MPH course at the same time. So we have MD MPH students who are training as physicians. We have aerospace residents who are training to be flight surgeons or astronauts. We have different primary care physicians like me who come from different other countries. So when we have a class and we're discussing different public health problems, we have a very multi-perspective approach, and it's a very lively discussion, and it's very rich and informative. And I feel like that is very unique to UTMB.
And one of the things you shared is the diversity that's there, as you said, not just racial, not just community based or what they're studying, but also where they came from professionally before coming into the program as well. So those discussions really diverge in different aspects of this. Talk about that some, would you?
It helps a lot, especially when we are having some kind of an assignment where we are doing public health assessment. For the spring semester, we had to do a planning and health assessment of the community. And we had multiple views. Like, as a primary care physician, I was more into health. But as people were coming from kinesiology, arts, and dentistry, they were more into oral health, and they were more into mental health. And some of them brought in perspectives which were very new. So we had different approaches that we could add to the planning and health assessment. It wasn't just medical. Like, we were looking at the different aspects of the individual as such. What is their home income like? What is their home environment like? What access do they have? Do they have access to healthcare? Do they not have access to the basic necessities of an individual? And how can we help them? What are the small stepping stones that we can place so that they have a decrease in disparity, and we can increase more equity for these individuals in the Galveston community?
And Robert, let me ask you this. What are you hoping to gain out of this once you got that doctorate? What are you hoping to gain from this as a student now?
You know, I think that's such a overwhelming question, because I think about my journey in that overall I want to empower the community to take ownership of their health, but also ownership in social responsibility, and being conscious about the needs that we are experiencing on different spectrums, that health isn't just a linear experience for everybody. And we need to do our best to become more informed individuals, to make decisions that are not going to just impact ourselves, but the community. And I think we had that opportunity because of the COVID pandemic. I think more people are a lot more engaged with health overall, and people are curious and they want to know how to participate in their healthcare journey. And I think
not just no, go ahead and finish up there.
I think we have that opportunity in the grasp of our hands.
Yeah, and not just participate in their healthcare of maybe as an individual, but also for the communities in many ways. You bring up a good point, Robert. Is that I think we saw this a lot too. Is that folks would go, they would research, and they would go to seminars, they would go to a clinic or something. Or if they were learning about COVID, they were taking it back to their churches, they were taking back to the community centers and sharing that information, saying, "Here's what I learned so far." But in many ways, too, Martina, is that we're finding a generation now, and I'm not trying to make y'all sound like you're the young generation taking over for us old folks, but along the way, but you are. So let's admit it. But that there's a new kind of approach. I say new, but not so new, but more of an aggressive approach from folks in y'all's generation here that are looking for something more than just the grind of the job. Is that a fair assessment?
Yes, for sure. For me, it was definitely that way. I didn't want it to end, and it felt like it was not a complete end when I would give a prescription to an individual, and when he comes back to me, his blood pressure was still high. And I would not know why, but I would still go on like, you need to take your medications, you need to take it at this time and this time, and you need to make sure you are consistent with it. But I wouldn't know what the other factors are. So I felt like I was in the dark in some aspects. And so this public health aspect, or the public health field, has grown so much. Like in the 1960s, we were doing public health advocacy for screening, for gender, becoming and making it mandatory. I feel like at that period of time, public health was doing advocacy, and awareness slowly started happening after that. So now we have grown as a population where we are slowly going into a very individualistic approach. Science has grown far into that, where we can tailor the treatment to the patient. It doesn't have to be a broad approach. So now I feel like as a public health candidate and as a physician, it is our responsibility to educate and inform patients on the different aspects of their disease and their treatment and the access that they have to make their lifestyle according to however they want it to be. And public health has grown wonderfully so that we can do this at this day and age. So I feel like most of the public health professionals and the physicians would agree to this. It's becoming a very interprofessional approach where care is patient-centered, it's evidence-based, but also we are trying to bring both of it to equity, where we're trying to make sure that everybody has the access and the equity to the best healthcare and the best lifestyle that they can have.
Before I get into my next question on that, let me ask this, Martina, because you talk about the healthcare equity, and as I said earlier in the show, is that a lot of times when we hear that term, it's a political statement versus a training side of things, or a culture, more importantly, within that. I wonder if you see the promise and the hope of this school of being able to change attitudes about public health in the long run as more people go through it and understand the importance of public health.
I completely believe that. And we have been doing that for a while now. So last fall, we had a nonprofit organization, It's Time Texas, do a seminar, and different students from different schools had gone onto the seminar. I was one of them. Another colleague of mine was one of them. And we were talking about the different health disparities in Galveston and the food insecurity that we have over here, and how we are trying to make sure that people are going to have more access and less or decrease the food desert. And this year, on June 16th, It's Time Texas is holding a virtual free Galveston regional workshop where they're trying to bring different organizations in the community, the healthcare professionals and people of the community, to come together and discuss about these problems. So I feel like the School of Public and Population Health at UTMB is already doing that. And I believe as we go forward, we will do this in a larger scale.
Because we've heard the term when we were talking to Kristen earlier, that that about preventative measures. The ounce of prevention is worth a pound of cure along the way. But that's been a topic used a lot, but you never see it get in practice fully. But now this seems to me, at least on the forefront, this could be the culture change that we need to see within the medical field. It's something we've talked about for the longest time, but people took different haphazard approaches to it. But now it's like, oh, wait, let's just go to the root of our medical community, train it there. And if it becomes part of their fabric, then it just carries on for generations. Do you feel the same way?
Most definitely. So the problem usually with a preventive measure is we know what the preventive measure is. For example, during COVID-19, wear a mask, social distance, 6 feet away, and you'll be fine. But a lot of people did not have access to masks because they ran out. A lot of people did not have enough space in their homes to social distance 6 feet away from each other. So these things are what public health usually shines a light on. We're able to see the disparities loud and clear, and having workshops like these, having the School of Public Health over here where we go into the community and we engage with them, it gets us informed about these disparities, and it prepares us for the next situation we'll have to face, a next pandemic or an epidemic, God forbid. But if we have this kind of situation, it helps us be more prepared.
Robert, along that same lines, though, there's something else that may change. That something kind of during COVID pandemic side of things, and when COVID's not gone away, but the pandemic side of things is that the mistrust of those in the medical field. And I wonder, I asked you this question yesterday when we were sitting down from our pre-interview, but I want to ask you it again. Do you see the possibility here of this type of program and the fabric becoming public health, that more trust can be built or rebuilt, in fact, of times of it's not from on high, the ivory tower telling us what we got to do, but actually communicating better, educating better, and making it part of the full fabric where folks will understand when we have challenges, they can be overcome when we approach things from all angles?
I definitely think it can. And I won't say either binary yes or no, because my faculty and my people that come before me have done a great job in their fields already. But I think what makes it different today is that we have more of a means to reach people and disseminate information that literally anyone can post an infographic and say this is science, right? And so I think the ongoing challenge, not just for our school of public health, but I think the field of public and population health, is we need to continue working on improving how to communicate to the community, how to develop strategies that are effective in a means that's going to educate a person, a lay person, someone who may just have a high school degree, a bachelor's degree. The spectrum is very vast, right? I think it's also important that part of that strategy is making sure that people like us are held accountable and that we continue to practice on an evidence-based approach so that we rebuild that confidence and that trust, and that we show a full level of transparency as to how we function as public health officials.
Martine, let me ask you, since you bring that international perspective here, where do you think, as you look at things on the U.S. perspective, of where the U.S. perspective is on public health versus, say, in your home country?
Here, for sure, the difference that I see is a lot of mistrust. It is there everywhere, but here specifically, I see a divide which is pretty big than what I've seen in India or where I grew up in UAE, where there is a little lack of transparency as well. And COVID-19 definitely decreased that transparency, decreased that lack, where there was an increased transparency all the way through. But the previous different health conditions or different outcomes that the population faced over here, I feel has developed a sort of mistrust. And we were doing a COVID-19 project where we were looking at or interviewing different people in Galveston and asking them if what it was that they took the vaccine or they didn't take the vaccine, what actually promoted them or what encouraged them to take it. And a lot of what we heard was the same thing. They heard from a trusted source, their physician or their children's physician or the church or somebody who they knew that it was a good vaccine, like the vaccine was safe and this is what is going to happen. And they disseminated this. And a lot of the people over here, since it's a very well-knit community, believe when another person say that this is safe and they trust each other. So I feel like building that trust, as Robert was talking about, is very crucial to being more collective and standing united when we have a decision to be made.
And it gets into as well, I think I'm hearing from both of you here, is that when you take that holistic approach, the full patient, the patient-centric approach, when it's based on that versus what maybe some people, the naysayers, particularly during COVID, who said, well, they look at these kind of monolithic buildings that have the fancy glass and everything else and think that it's about the money on that side of things and not about healthcare, that a school like this, a UTB School of Public and Population Health, where you have that hole and that fabric again, can go a long way to bring back that trust. Martina, I asked Robert this earlier. Let me ask you, what do you hope to get out of this?
I hope that I have a more larger perspective and I'm not as narrow in my approach as I used to be. And I feel like I can see the difference for sure now, just 2 semesters into my course. I'm in the 2-year program. And it's been a very great experience. We have great staff as well who are very approachable and who hear out different perspectives in class as well. Like, we don't just have a lot of healthcare input. We have, apart from healthcare, people who come from different backgrounds. So I feel like it helps me understand the patient more and where they are coming from. So I feel like it'll definitely make me a better physician.
Robert, let me ask you this. This is a question I did not share with you when we had our pre-meeting. So I'm gonna throw a curveball at you here.
Great.
What do you think, what you've looked at now, being a PhD student in this, of where do you see this school being able to expand at some point? As you look at it from what's going to be, mostly administrative career or data-driven career, where do you see, as you look at that, of where this school could be headed, that maybe right now it's not there, but you see its future being?
Wow, I think this school has been really driven by the voice of the student body in these past couple of years, with the consciousness of racism being a public health concern, that there are minority disparities that are very prevalent and very heightened. And I think this school is, for the state of Texas, pioneering for the first time in the state's history a more holistic approach with current topics that have always been there, but now they're exacerbated more. And so I think this school has the opportunity to continue being very innovative and continuously putting the lens on all of these issues in real time. I was very inspired and motivated by the student momentum that we have with sexual and gender minority health, African American and Hispanic Latino health. There's and so many other racial and ethnic minority group health disparities that the student body is putting on the spotlight, and the School of Public and Population Health has continuously addressed it and campaigned to better understand those disparities and address them.
And I think what I'm hearing from you there too, and I find this really fascinating, is that the school itself has become, in lack of a better term, student-centric in many ways too, as well as y'all are studying to be patient-centric, but the school itself has kind of started off with its fabric of being, student-centric. Am I hearing that right from both of y'all, the way y'all talk about this program?
Absolutely. Absolutely. I think Dr. Prochaska, Dr. Peake, and Dr. Pennel have consistently showed an interest and have invested in the student body to take leadership positions. They hear our voices, they hear the concerns of the students, and they act on it. And that comes from experience back in 2017 for me. And so our direction is very strong with our leadership right now.
And with that endorsement from Robert, then we'll bring in back John, Kristen, and Cara back in with us now, our full panel here. Sorry, Cara, I covered up your face there for a little bit from that. But what's one of the things for folks that don't know, kind of the behind the scenes, is while the others are on, I can watch the faces of everyone. And when Robert gave the glowing recommendations there, I think John was writing down notes to make sure that, to add to it there. But when the three of you hear from these students in your program, I'll start with you, Kristen. How does that make you feel about this decision to start the school up? And you guys had to do it quick, from when it's like, okay, y'all can do it, to let's get ready in a few months. How does that make you feel now that you're already having the impact after hearing from both Martina and Robert here?
Oh, super proud. I mean, I'm like, let's just graduate them both right now. I mean, you guys are doing you students, I shouldn't say you guys, are doing such an incredible job of marketing for our school. I mean, we don't need any other marketing but y'all. They're just doing a wonderful job. All of our students are doing a great job. I really do feel like the school, as we've moved forward in this, we have this unique opportunity to build something, not just one or two of us, but really as a team. The faculty have been involved, the students have been very involved, the university has been involved, our community partners have been involved. And I don't know, there aren't many opportunities like this. So I'm just grateful to have this opportunity. The students were involved in our vision and mission building processes. We're going to have the students, I think, on every committee that we've set up. We redid our whole committee structure. We have student representation on every committee. So we really, really, really do put students at the forefront. And I'm just thrilled to hear that come across when I hear Robert and Martina talk about it. It's, like, okay, cool. We're on the right track. So, they're two of our best students, and we have many other wonderful students. And I'm just really grateful for this opportunity.
How many students are in the program right now?
John, I think, how many do we have? About 120?
121.
And that's double from before. Is that right, John?
Oh, no, the applications that were coming in were double.
Are double. So we're at
right.
121 now, and and almost be almost 250 when this new application process.
We're looking to grow.
Yeah, that's something else. Let me ask you: when you heard those glowing reviews from Martina and Robert, and you didn't pay them for those, I know that much from that. But how'd that make you feel, John?
Kristen summed it up so well. I'm proud. It's one thing for us to articulate our vision for public health professionals graduating from our school. It's another thing when you have students being prompted by somebody that hasn't talked to them before, asking them what do you hope to come out of this school, and they're saying something better than what you would have said in the first place. Pride is probably the best word, even though it's probably not good enough. I just don't have a thesaurus in front of me right now to look up the best word for it. But it's a shining example. Both of them are shining examples of what our programs can do in terms of creating the new highly trained and competent public health workforce in the region.
And Cara, you've talked about it, your history when working in public health. Now you're on this side. I would take it then that you see this as what we talked about early on, kind of the core of what the show has been talking about here, is that it is hopefully to change the fabric of how we approach public health here. And that, as I think we heard excellently from Martina and Robert, is that fabric is being established already here with these two and the other 110 students that are with them in this program right now. And for you, as having worked, like you said, 20 years, and as I jokingly said yesterday, you started when you were 2 in public health, but that you see that goal, that light at the end of the tunnel may be of how I don't want to sugarcoat this in any way, but at the same time point out there could be a real game changer happening here, that we're seeing just the seeds being planted, starting with UTMB Health with this public health education.
Absolutely. And, the students are really the heart of our program, and they are what drive so many of us to do what we do, because we know that they're going to go out and they're going to change the world. I tell students this all the time, that this generation is going to be what makes the difference. Because like you said, TJ, you're talking about, it's more than a job. I mean, this is a passion. This is, we often joke that public health is everything, because it really could be. But yeah, our students are just, they're the heart of everything, and we're just so proud of them. And, when we think about public health, it's often said in our field that, we're looking at where people live, work, play, and pray. And so we want to be, it's not just looking at patients in the clinic setting or once they get to the hospital. It really is looking at how communities live their everyday lives.
And I think the term was used, healthcare is a lot of times based on, someone's health is based on your zip code more than anything else along the way. And what we could really kind of learn from all of this is that it gets into, community-based health prevention as well. Correct? That's for you,
Yes,
Cara.
yes, that's absolutely right. Sorry, I had muted myself just in case you were going to go on to someone else. Yes, absolutely. One of the things that our Master of Public Health students do as part of the program is a public health practice experience where they go out into the community with, it could be a local health department, a state health department. We've even had some PhD students go on to the World Health Organization to do their practice experience. Could be working with local hospitals and nonprofit organization to apply the skills and the knowledge that they're learning through the program and in the classroom to the field and to the community in ways that are beneficial to those organizations and agencies that they're working with and to the broader community.
As we wrap it up here, your final thoughts, anything you hadn't covered you want to make sure folks know? I'll start with you, Cara.
I don't think so. I just, we're so excited as this school, as we build the school and as we continue to grow, and thrilled that our student population is growing and are just excited for the future.
John, how about you?
Sorry about that. Excitement and just thinking about how this continues on the mission of the university, which it was founded on those many years ago. It's just a natural next step in what UTMB is wanting to do to improve the health of the community, the state, and the world.
And Kristen, for you, some exciting stuff. You're going to get your own facility now.
Yes.
Talk about that. That's going to be, you're not a real school till you actually get place to go, right?
That's right. The president and the provost have agreed, and actually we've already kind of broken ground on space over in the university hospital clinics. So our building, we are going to be here, that our department's in, for about another year. But then we're going to move more and centrally located in campus, which is really exciting. And they're redoing a bunch of space on the 4th floor of the hospital clinics, and our new school will move over there next March or April. So we're very, very excited about that.
Looking forward to the ribbon cutting when we go up there and do that.
Absolutely.
Hopefully we'll see Martina and Robert there as well. Martina, your final thoughts today before we wrap up.
I would like to say, apart from everything that's been said, that if students want a very diverse experience and want to feel part of an organization, not just a school, and want to be felt heard and have a very rigorous syllabus and a good syllabus come in to UTMB School of Public Health, you will get all what you want and a good experience out of it.
Robert, how about you? Final thoughts?
I think that with public health begins with you. It begins with us. And if you want to find your identity in the public health field and population health studies, please apply to the UTMB School of Public and Population Health.
See, that's a great segue, because he knew right the next thing I was going to do was to pop up it's come up a couple of times, but pop up the website if you want to find out more about the UTMB School of Public Health and Public and Population Health. You can go to utmb.edu/SPPH/home, or you can go to SPPH. It'll get you there as well, and you can find out more about the program, particularly if you want to enroll. And if you have a high school student, for example, who's interested in this, and they go in college and they want to go to the next level after their studies in college, this is a program to be looking at as well for that as they plan out their future along the way. We have a link also, you can click on it in the comment section. You can take a look there. So thank you all for being a part of this today. We do appreciate it of y'all being a part of this conversation here today. Kristen Peake, the Dean of the School of Public and Population Health at UTMB. Thank you for bringing the whole crew and getting this all together and organized for us here today. Again, folks, this has been pre-recorded, but hopefully the questions are getting answered you have there. If not, you can contact the school directly. They're pretty open about that. Before we wrap up the show here, let me just remind folks as there's going to be a hiring event that UTMB has going on, and that's going to be at the Angleton Danbury campus that's coming up on May the 26th. You want to make sure you're checking that out. That's coming up at May 26th, the first floor there on East Hospital Drive. That hiring event is happening there. A lot of jobs, many in public health too, studies that they can help out there. But these are mainly on the side of things. But you want to get out for that hiring event happening again. It's the career open house. We had the one at the end of April that happened at the League City campus. This is over for those of you in Brazoria County at the Angleton Danbury campus. You see the details there. So check that out. Coming up on May 26th from 9 a.m. until 3 p.m. Find out more on UTMB careers, where you can find that online. Thank you all again for being a part of this here today. It was an enlightening conversation, and I'm excited because we finally got some students involved. And I loved it when we started adding patients on some things, but to have the students involved, Kristen, I think you said it better. They're the best sales folks you got.
Absolutely.
So yeah, go ahead, and I think Robert and Martina will be in your office here shortly to go ahead and get their diplomas. Since you said graduate them already, I'm just kidding. They're having good, but thank you all for being a part of this. Make sure you join us in June, third week of June. We'll have our next issue of UTMB Healthcare Unmasked. I'm TJ Allis, I-45 Now and Galveston Now.